My name is Jill Phillips and I'm the creator of Whose Shoes, a popular approach to co-production. I was named as an HSJ 100 wildcard and want to help give a voice to others, talking about their experiences and ideas. I love chatting with people from all sorts of different perspectives, walking in their shoes. If you are interested in the future of healthcare and like to hear what other people think, or perhaps even contribute at some point, Wildcard Whose Shoes is for you. So thank you for following this mini podcast series using our Wildcard Whose Shoes platform to discuss universal healthcare with the people who are actually making it happen. The series is in collaboration with London South Bank University and the Universal Healthcare Network. Today I'm talking to Bill Graham, who's another close ally of Professor Becky Melby. Becky is a co-author of the Universal Healthcare National Inquiry Report and the mastermind behind this set of podcasts. She will be back in the next episode telling us what she thinks about the conversations we've been having and how we can all take this forward. Bill is in an innovative role, serving as the linchpin between the community and primary care in West Yorkshire. Building on the last episode with Kim Shuttler, who talked about the important role of the voluntary sector in transforming healthcare, Bill will give us some great examples of how this all works in practice, reaching out to where people are and helping them transition back to the NHS. So welcome, Bill. Can you start by telling us a little bit more about yourself and how you got involved in this groundbreaking work?
Hi, Jill. Yes, thanks for asking me on the podcast. My name's Bill Graham. My background isn't a health professional background. My background's more in community and social enterprise. So I kind of come from a different perspective to the challenges of primary care. So, a lot of my work leading charities, working with community associations, and I was in that side of the fence, trying to link in with health and trying to show how communities and people could help some of the challenges in the health system in Leeds was facing at the time. And we took some of our projects from being grant funded to commissioned, and we built a fantastic community centre in a very, very, a fantastic part of Leeds, but also a very deprived part of Leeds. Yeah, but really showing how investing in community can really help produce better outcomes for people's health and opportunities in life. Then I got the opportunity to join the Modality Primary Care Network because one of the GPs I worked with in Leeds joined this Modality Primary Care Network, and they wanted someone to come and maybe connect themselves better into their community. So I moved over there almost 6 years ago to work in Keighley, Airedale, parts of Wharfdale, and up towards Craven and Skipton, where we've got 8 GP practices which we've merged together to become one big practice. So one practice, one primary care network with about 90,000 patients. So for me, that's been a fantastic opportunity to work with a primary care network that's determined to make the most of what a primary care network can be.
And a big one.
And I think we're a really good example of what you can do if the constituent parts of a primary care network, which tends to be independent GP practices, are actually willing to come together, merge and become one practice, one PCN. It makes the whole process of doing the work I do a lot easier, and to then bring in the resources to deliver the work I deliver as well, which is also something I do.
So this is the fourth in our series of talking to the various guests, and we've heard quite a lot about what the challenges are coming through in terms of doing this work, and I'm sure you've got a lot to say about that, Bill, but if we can focus as far as possible on solutions now, what can people actually do to reach out in the way that we're talking about to the community and get people involved in their own healthcare?
Yeah, I think in primary care, again, as someone who's kind of jumped over the fence from the sort of voluntary community side into the primary care side, it's actually a real privilege to see how general practice operates. And I don't think the general public really understand the the sort of the challenges general practice has on a day-to-day basis, about how it deals with the demand, about how it's an open door service, about how patients themselves can be very critical of the service they receive from general practices. And currently there's a lot of press and media about general practices around the country.
Yeah.
So to be able to get behind the scenes and see how it operates, for me, it's been a real privilege. And I think the biggest challenge with general practice and being able to work with communities is, in many ways, I think general practices, they open their doors at 8 a.m, and when they shut their doors at 6, they've survived the day, and the next day is the next day, because they're focused on getting through the day quite often.
Yeah.
Because quite often they're understaffed, under-resourced, people will be off sick, there might be a lot of demand that day. And how do you deal with those challenges? It's really difficult. And for me, again, coming from the community side, I think a lot of community organisations work like that as well, where they just deal with the day-to-day challenge. So I've always thought you've got to get your head up and try and get yourself out of the day-to-day cycle and start to think about how you can do things differently. So first of all, the first solution I always think is trying to make some time to understand what's around you, to understand your community, get to meet your community, and see how people and communities can help with some of the challenges you've got with that day-to-day issue. For me, then it's about, those solutions. It's building those relationships. It's getting out there and to build a relationship. It's easy to say go out and build relationships, but the practicality of that is, what do you do? And what I would tend to do is I would walk around my local area and get a feel for what happens in your local area and get to meet and talk to people.
Right.
And then I noticed that by being visible, being present in your community on a regular basis and getting to know folk, that's the key that helps you build that trust and getting to know people and getting them to understand the challenges that we face and the challenges they face and how we might work together on those problems. So I think that for me is the key building block in how we face up to these challenges, and that's the key part of the solution. Because unless you've got that in place, then you won't really find out what the answers are.
Yeah, and I think there was something around targeted work with communities, really building directly on what you've just said, Bill, in terms of this is the problem we're trying to solve, and bringing community partners in to help with that specific problem. Is that one of the approaches that you're using?
Yeah, I mean, I've always referred to it as it's a flexible approach that uses the data as well. I think the health service has got lots of data about what the problems are, about things like health inequalities, and it's great having that data. But you need to have a real flexible approach how to start to come up with plans about how to actually do stuff. In Kim's podcast that I was listening to, it was that idea of starting somewhere.
Yes.
And I'm a great believer in this. You start somewhere. We can all sit round tables and plan and design and think about what a really good project would be. And in the health service, I think, there's a lot of people, with a lot of brain power thinking about what the solutions can be. Yes, I'll get involved in processes like that, but I don't think anything beats just getting out there and getting something started, getting it going.
Yeah.
And I think you learn as much by doing stuff as you will by trying to produce the perfect plan on a table that you then try and implement. I'd much rather be out there getting something underway, and then you just pivot and adapt as the work continues. And that for me is the key thing. And I think we can be very guilty of sitting behind our desks and thinking about the problem and coming up with those plans. Well, for me, rather than sitting behind a desk thinking about a problem, I'd rather be out in the streets, walking about, meeting folks, sharing the problem, and then starting to do something about it. And it might not be right first time, but, by finessing what you do and working with partners, you come up with a better solution.
Yeah.
I think. So that's always been my way of doing things. I'd rather be doing something than just sitting thinking about a problem and trying to come up with a solution in a room with other people. I don't think that's the right way. And that's a bit of a top-down way of doing things as well.
It is.
I think people would say the way I work is that kind of asset-based way. using what's around you, using the assets in the community, using the people around you in the community to help you come up with the answers, rather than thinking you can come up with the answers yourself.
Yeah.
By sitting in a room looking at the data. Anyway, that's just me, John.
And it's not just you in that I think you've picked up there, Bill, really strongly the kind of call for action that's been running through the series in terms of the people I've been talking to, and obviously through the report itself. I think one of the strongest recommendations is to start somewhere.
Yeah.
And I love the simplicity of that. And just hearing you talk feels exciting. You get out and you talk to people rather than talk about them in a closed room and wondering what to do. And it just feels as if that way you start to hook people in to want to work with you.
Yeah. I mean, people talk about things like co-production and co-design all the time, but I think in reality, there's not a huge amount of that goes on. And I think co-production and co-design is actually getting out there and getting people involved. I think you have to accept that when you work with communities and people, it's going to be a bit messy and it might not always go to plan. But I think if you accept that, then that's fine. And like I say, it's better to be doing something and it's a bit messy than not to have done anything at all.
Yeah.
And you're just worried about, we might do it this way and it might get a bit messy. Don't worry about that. And the thing about things, if you do stuff with people and things do get a bit messy, but you're having to talk about that kind of builds your relationships. It builds the trust between you. It shows folk that you're not a here today, gone tomorrow type person, or they've encountered a problem. We've had services try and do something before, they come along, it doesn't work, they disappear. You're kind of in there for the long term and you're accepting that it might not work first time, but we're going to stick at this and we'll make it work because the data tells us there's a problem here. So let's figure out a way to sort it out together.
Brilliant. So what kind of examples, I know I've heard bits and pieces about what you're up to. What could you tell us in terms of the practical examples of going out and reaching out to the community where they are?
Well, there's some terrific work we've done in the last few years. I think we always start with the COVID vaccination programme.
Yeah.
Where, because we had some great links into our local communities, we were able to really maximise the uptake of the COVID vaccines, particularly amongst groups of Asians who maybe were a bit hesitant about vaccines at the time.
Yeah.
So some of the Asian population, some of the younger members of the population, we did lots of focused and targeted co-produced work. We ran lots of education sessions, we ran lots of stuff on things like social media. Then we actually ran the sessions themselves in kind of shopping centres, mosques, churches, community centres. We got out and about and delivered that work in the community where people were, which I think was hugely important, and also took advantage of the voices of the leaders of those communities themselves.
Yes.
And also using the way different communities use different ways to communicate. An example is the Asian population in Keighley use WhatsApp groups often as their means of communication, or they have the mosque radio is something they use. So you're taking advantage, getting to know your community, you understand how they communicate with each other, and you're able to take advantage of that, which I think is hugely important as well. And that gave us some fantastic links with a lot of community organisations. So now those networks were built up, that trust we have with lots of different communities and groups around our area. We use that now to help us come up with solutions for the challenges we have in healthcare in our part of the world. So it's things like undiagnosed hypertension or blood pressure in general terms. And we go out into community settings. A great example is we were at the rugby league game in July, where we have a rugby league team in Keighley Cougars. And last year they were playing Bradford. This year they were playing Rochdale. But we are there with our stand, and we work with our community group partners. We've trained their community workers in helping us do things like blood pressure and health checks. And we're out there getting those middle-aged men that we know have undiagnosed hypertension, but we're turning up at a sports event where they might be. So you're kind of thinking about events. Where are the people going to be? It's much easier to go to where the people are than get the people to come to you.
Yes.
And the rugby league game's a great example of that. Other examples of going to where the people are is, we've been on the road all summer, actually. We've been at Yorkshire Day. So again, you're in this town centre. They're celebrating Yorkshire Day, lots of activities and things for the kids, things for the family. And we're there doing well-being checks, blood pressure checks. So really spreading the word about that sort of thing. And it's not just about hypertension. So the other challenges we have in Keighley is young families and babies. There's not a huge amount of support for young families and babies. And from a primary care point of view, we have a low uptake of some of these childhood vaccines.
Right.
So we work with our community partners. There's something called the Maternity Circle, and we've got other kid services as well as some statutory services. We run our baby days, and we run them from the shopping centre. So again, it's not in our primary care surgery setting. We're out in the shopping centre where we know there's going to be people because people are out shopping, and we're there able to catch the people with their prams as they're coming back. Are your kids up to date with your immunisations? Do you want to meet some of the community support that's available for young families? And it's hugely successful. And we've taken those immunisation rates in Keighley from around 60% up to 90% in the last 9 months, Jill.
Wow.
It's a fantastic example.
Yeah.
And across Bradford, there's an issue around uptake of those measles, mumps, rubella vaccinations. And I think we've shown a really effective way of working. We couldn't have done it without the community partners because they have those activities that the little kids see and they want to take part, and then that gives our nurses a chance to talk to them, or the community workers that are working with the families will be then encouraging the families to make sure they're vaccinated or have they had their baby checks up to date. And we've even now got those community groups running sessions, which is fantastic as well. So, and I think in some ways it shows the hollowing out of health services, because I think district nurses and health visitors used to do that, but they don't tend to do that anymore. So that's something general practice had lost over the last maybe 10, 15 years. But we're coming up with a solution with community partners to deliver that work.
It's a solution that really makes sense, doesn't it?
I think so, yeah. Cancer, prevention of cancer, there's another one. So next month we are running our Women's Health Month. And again, it's we have community organisations. We've trained 20 cancer champions. So these are ladies from lots of different communities who are out there encouraging people to take up the offer of the cancer prevention services that are out there, whether it's the bowel screening service, breast screening service, or the cervical screening.
Right.
Because again, in Keighley, we have proportionally a lower uptake of cancer prevention services. And so the upshot of that is that in our local hospitals, we have a higher number of people presenting with later stage cancer.
Right.
So, the aim there is obviously if we can increase the uptake of the preventative services, then we might see less people presenting at accident emergency or in secondary care with late stage cancer, which might have been preventable. And again, the figures from around the country will show there's parts of the UK where people are very high users of the preventative services when they're offered, and they have better outcomes. They might have longer life expectancy, those parts of the world. And we work across from Skipton to Keighley, and we know that the life expectancy between Skipton, which is quite often voted one of the best places to stay in Britain, the life expectancy in that in Keighley, which is quite often voted one of the less enticing places to stay in Britain, to put it politely. The life expectancy differential is about maybe 8-9 years.
It's huge, yeah.
But then we're very focused on how can we use our community partners to help us with that big challenge. So the challenges don't have to be small or unimportant challenges. I think if we're talking about undiagnosed blood pressure, we're talking about babies' health and young families' health, and we're talking about cancer, we can probably take on some of those really big challenges that the health service faces, and we can come up with solutions that the community and the people in the community can really help us with.
Yeah.
And having people in the community trained as cancer champions, encouraging the folk in their communities to take up those appointments or take up those offers of cancer prevention and explaining what it is and what it is really important, Jill. And I'm really looking forward to seeing the results of that type of work as well.
I think it's fantastic work, and I think for me it's exciting as well in terms of the podcast series, because the very first guest that I had, and again a friend that I've made through Becky Malby, was Dr. Fazana Hussain, a GP in London. And what you're saying, obviously completely different part of the country, but just the same issues in terms of, I think if you catch a train across London from east to west, there's something around each mile or two adds an extra year to your life in terms of average life expectancy. So it's all these health inequalities, isn't it? And again, Fazana came up with really innovative ideas, and during the pandemic of getting those babies to come along to clinics and building trust with the Asian community and various communities in terms of finding out where they're coming from to understand what's going to actually make them say yes and want to take up the offer of healthcare services. And it's trust, isn't it, and relationships.
Trust relationships. It's being accessible. That's why I love the shopping centre. I love being in the shopping centre because whatever you say about general practices and maybe people aren't sure about how to access them, or it may be difficult to get an appointment, if you're in that shopping centre, you've got a lot of people walking past and seeing what you're trying to do. So we've done baby days, we've done lots of vaccinations from there, we've done obviously flu campaigns as well, we've done diabetes days, we've done mental health promotion work from there, we've delivered work around health checks and events to support our carers. There's a carers day we run every year from the shopping centre where we invite our carers along to maybe have a health check, maybe speak to a health professional, or maybe just have a massage or have some services there. And we always have some refreshments and food. And in some ways we also say that's a thank you to the carers that we have that are looking after folk locally, because sometimes it's the unseen heroes of the health service as well.
It really is.
And again, we link up with those community organisations who work with carers. They couldn't do this. We can't do this on our own. So our local organisations like Carers Resource and Keighley Healthy Living, they'll be there to support us, and also gives the carers the options. They can see what additional support might be available for them in the community. So I think working that way is great.
I'm so glad, Bill, that you've mentioned carers, because as you say, they can be really unrecognised. And I should think that's not only effective in terms of offering people the health checks and so on, but massively appreciated. So thank you for doing that. I do quite a lot of work with carers, and I just know how they're putting somebody else's health needs or just life first, and getting that opportunity for somebody to look after them. Don't underestimate how well you're doing there, I think.
It's one of the best days of the year for me.
Is it? Yeah, I can believe it. I can feel that.
Since I've turned up, I always make sure we do the Carers Day. During Carers Week's always in June.
Right.
And we always have a Carers Day, one of those days in June, and the last few years we've run it out the shopping centre. And the thing is, people who care for folk, even in wheelchairs, the thing about the shopping centre is it's incredibly accessible because they always know how to get to the shops. And the other thing about Carers Day, they can obviously bring the person they care for as well.
Yes.
Because quite often people who care for someone, they don't want to leave that person on their own. And we think the shopping centre's a place, we know from the feedback, it's a place people know. They know how to park, or they know how to even get the bus there because it's beside the bus station. And it's all on the one level. It's easy to get in and out of it, even if you're in a wheelchair. And that for me is important as well.
It's simple, which makes it brilliant, I think.
Yeah, no, it's good. And just touching on that, just another group that we target with some of this work is our learning disability, patients with learning disabilities, or mixed ability, I much prefer saying. And those mixed ability patients, we run events for them to come along to have their annual health check. We've run them at the rugby club.
Right.
And again, we have the local VCS and charity organisations that support folk with learning disabilities come along as well, so that people have the opportunity, if they haven't already, to get to know the people who might give them additional support, help, days out, chances to get together, to meet and get together. So, for me, that's another really important, not all patients are important, that's a really important group of patients to make sure that we're doing as much as we can to support them and help them and make sure they're aware of the help that's available in the community as well.
So what I like about that is something like the annual health check for people with learning disabilities is a requirement, but you're turning it into an opportunity to offer them more.
Yeah, well, absolutely. Yeah.
Yeah. And that's what needs to happen, isn't it? Rather than the tick box somewhere, that, you know, something like that is an opportunity as well as a task to be delivered. And I can feel you doing that, Bill.
Yeah, our links with the rugby league team means that we run our Keithley event at the rugby league ground, and if the weather's nice, we have the kids or the people learning disabilities, we have them on the pitch playing games with the International Mixed Ability Sport charity.
Oh my goodness, right.
And we have them playing games, and they have a great day out. And obviously, we make sure there's some sandwiches and a cup of tea there, so that everyone can get a cup of tea and a sandwich. The carers obviously enjoy that as well. So the health check is part of the day, but it's also a lot of fun, Jill.
Yeah, brilliant. I love it. Yeah,
and it should be fun.
It should be fun. Yeah, life should be fun. So if you can build these things into day-to-day life rather than a separate appointment in a building, that's what it's all about, isn't it?
Yes. So there was a couple of other things I wanted to mention. I mean, I said there at the start, we do a lot. Another project we've just started is our multi-generational home visiting. So we talk about taking primary care to the people. So we can identify, obviously, people who aren't turning up for their primary care appointments, or they're not coming to our GP practice. And in many ways, I think GPs will be, well, that's somewhat that we don't do because they're not attending.
Yeah.
So we've got an active project at the moment where we're actively going out to folk, and it tends to be multi-generational households we've identified. So we'll identify households with various, there might be several people in that household of different ages. So we're going out there and we're having an appointment with them. We'll have maybe a GP or a nurse, maybe a pharmacist, maybe a social prescriber will go, depending on the need. And we'll try and get that work done in the house, in the place. And that's to try and build that link again with primary care, because you're never sure what the reasons are why they're not coming forward with their health problems, or they're not taking up the offer of healthcare. And that's been terrific because, already the ones that we've been out to visit, we've now got them making those appointments that they should be making at the surgery. And again, that's building the trust back with some patients as well, or maybe just making yourself a bit more visible and accessible to them.
Right.
So for me, we call it the multi-generational home visiting project. But for me, that's really a fantastic piece of work, which we're in the middle of at the moment. But I'm sure we'll have some really good results from that. And I'm hopeful it might become work that will be more broadly available, because we know about health inequalities. And we know the parts of the geography where maybe people aren't coming forward for their health appointments, and that has an effect on health. And, there's lots of reasons why people don't come for those appointments. But this is a way of actually us using our... there's one thing about general practice, great data on the patient population. And you can identify the folk who aren't coming for appointments, but maybe should be coming for appointments. And instead of just leaving it at that because they've been invited and not attended, it's actually going out there and maybe seeing them in their home. So that's interesting. I wanted to mention that, Jill.
Yeah, no, I'm glad you've mentioned that, because I've never heard of that as an example, multi-generational and going out to people's homes. And, you hear about prevention, and that's exactly what you're doing.
Yeah, it's also giving people the healthcare they should be having.
Yes.
And for whatever reason, they've not attended the invite, or they've not attended the appointment. And maybe there's a problem with the way we do the invites in primary care sometimes as well. So that's just a more proactive way of maybe doing that work. Yeah, the one other thing I wanted to mention was our digital outreach stuff. And again, in primary care, we're really keen for people to use the digital health services, whether it's the NHS app or, the digital service you might use to contact your general practice, or other digital health apps that might help with certain conditions. And of course, there's a lot of patients out there who aren't really keen on using digital services.
Yeah.
But they can be incredibly helpful. So we have some volunteers, again, we've trained up. So, you're using the assets in the community. Some of our patients, some of them, I've got Martin, who's 70 years old, as an example. So he's not a young, but...
Really, yeah.
But he loves the digital health, and he's a terrific advocate. So he goes out with me. We go into community settings. Sometimes we even do it in the waiting room in surgery. And we chat to patients about using digital services. And Martin, will show them through on his iPad how to use services. He'll get them set up the NHS app. He'll get them set up for our digital services. He'll show them how to use other digital services that might help them. And that's terrific work as well. And again, it's it's one of those barriers some people have where they don't feel they can use it. And there is lots of help out there for people to get hold of actual tablets and computers or phones. So there are projects and programs out there that fund people who are digitally excluded to get them digitally enabled. So, we can help folk with that as well if they so wish. And we're not demanding people use digital services, but the thing is they're maybe missing out on what could be good for them. And I think when it comes to like ordering prescriptions and things like that, things like the NHS app are hugely helpful for folk, rather than bits of paper which we know can get lost, or people can't find, and then they have to make a trip to do something else, where it might be easier for folk sitting in their house and ordering stuff via their phone or their tablet. So really keen to mention that as well.
I'm glad you have, and I'm sure that Martin gets a lot out of that as well, and that's what it's about, isn't it? Like you say, asset-based communities, using the skills that you've got.
Yeah, he's definitely one of my top chaps, top volunteers.
Yeah, brilliant. So all this work that you're doing, Bill, and thank you so much for telling me about it, do you have a way of defining it, would you say?
Yeah, I think we kind of call it high street health. So it's that focus on being accessible, being in your community, being visible. I think it's all those things we chatted about the challenges, and we're trying to address them by being, accessible and visible. We kind of call it high street health. I think it's a terrific way of looking at things. That's how we kind of refer to it when we chat about this work.
I think that's really memorable. I've not heard of high street health before, and I think straight away it brings for me back all this conversation and the examples you've given. And I love the way that you've combined day-to-day things like shopping centres, where there will always just be people, and actual events like your rugby day or the specific events, the Yorkshire Day that you've mentioned. So this is the end of the series, other than coming back to Becky and she's going to pull it together for us. What do you think, Bill, what would be your call for action then as to how other people can do the kind of things that you're doing in West Yorkshire?
That phrase, just doing something, or something somewhere, do something is really good. I think for me, again, I was listening to Kim's podcast, the system and the leadership that we have, and I think across the health service. I think, anyone looking into it, it's incredibly complicated. It's complex. There's layers upon layers in our National Health Service, whether it's primary care, secondary care, care trusts, ICBs, ICSs. It's almost impenetrable. And I think there's a lot of good people in that system trying to do good stuff.
Yes.
But I think when they design things, and maybe this is going back to, they use the data and they try and come up with plans. I think when they design stuff, you're quite often in danger of being the committee who tried to design a racehorse and come up with a camel. But, again, they're good people.
Yeah.
They're doing it with the best intentions.
Yeah.
But I don't always think what the end result is what could be the best practice or the best thing to do. So I think in many ways it's about, the call to action is to encourage people to get out there, meet people, make people in communities, part of the solution, if not maybe helping lead the solutions. They've got to be brave with the resource and the funding they've got. They've really got to be brave with it. You've got to take risks with that. I think when they think about investing in communities or community solutions, they see it as quite risky. But, I come from that background, and I think Kim mentioned this as well. You'll get much more value from the money you invest in the VCS than you will by just putting money into the same things you've done previously.
Yeah.
It's that idea of the definition of madness is doing the same thing over and over again and expecting a different result. And I think those good people in the health system all want to do preventive stuff. They all want to involve the community more, but there maybe needs to be just that willingness and that bravery to actually turn those words into a reality. That's what I've always noticed. There's always a new priority will come along in the health system, whether it's the cost of living crisis, whether it's COVID. And so those plans to do something differently are suddenly stopped because, no, we've got a bigger problem over here.
Yeah.
And that's why prevention and that will always not be top of the agenda, because there's always something found to stop it being top of the agenda. So I think that for me is a really key thing. I think you learn by doing, getting out there and doing it. So it's that sort of idea of just doing something. You learn by doing, you'll make it better. And it's just get out there and make that change happen. And for me, I think Vincent, who's our Modality CEO, has said that I'm like an army of one, because I'm out there making all this stuff happen. But, what Vincent doesn't always realise is it's the relationships I've built that makes all this possible.
Yes.
Because it's not me doing it. I turn up sometimes and things are just happening because I've brought the people together to make it happen, and it's not me doing all the work.
Yeah.
I'm just the person who can hopefully bring folk together to make it happen. And, it'd be great if we had more of these kind of community connector type roles to make that link between primary care and community, Jill.
Yeah.
I've added up our primary care network. Now, bear in mind, there's 1,500 primary care networks in England. Our primary care network in the last 4 years has invested, not far off, £4 million, £1 million a year into community services. Whether it's integrating, I think Kim mentioned it, we've got some of Kim's staff work for us, and that's integration. That's her staff talking to our staff every day about our patients, and they then have all those seller trust services, those specialised community health services to get folk into. That's real integration. That's us spending our money with communities. We've also raised money with funders to deliver work as well. It's been terrific working with the Modality group, because they've let me go on with what I think is the right thing to do. And obviously I come from the community side, so that's what I truly believe in. But yeah, I've always said, the health system, if it keeps doing what it's doing and it just invests the same way, it's never going to get that result it wants. It's never going to make that change. So the plea or the call to action is, please make this community and preventative agenda top of the agenda, and let's not make it something it's always warm words, but it's never followed through on with actual resources.
Yeah. Oh, thank you, Bill. And I think that's what I'm hearing throughout the series. And I think the other thing I'd add is enabling people. So I can feel that Tom, that George, that Kim and yourself work in a system that's enabling you to have that freedom, have that flexibility to make things happen, to get out there and to do the things that are your assets in terms of the things that you're good at, to get out in your communities and talk to people and make things happen. So I think that's a fantastic call for action at the end. And thank you so much, Bill, for joining me and for talking about this today.
Thanks, Jill. It's been a pleasure. Thank you.
Thank you so much for listening. If you enjoyed this episode, it would be fantastic if you would leave a review and a rating, as well as recommending the Wildcard Hoosiers podcast series to anyone who you think might find it interesting. And please subscribe. That way you get to hear when new episodes are available. I have lots more wonderful podcast guests in the pipeline. And don't forget to explore and share previous episodes. So many conversations with amazing people who are courageously sharing their stories and experiences across a very wide range of topics. I tweet as Whose Shoes. Thank you for being on this journey with me, and let's hope that together we can make a difference. See you next time.